Uganda is celebrating 60 years of independence at a time when it is credited as one of the African countries with the capacity to handle epidemics. The country has suffered a series of epidemics, like the current Ebola outbreak that is being battled, Marburg, yellow fever, Crimean Congo hemorrhagic fever, avian influenza, and recently COVID-19 that has affected the whole world.
In the 60 years Uganda has been independent, I am only aware in the last 5 years that the first Ebola outbreak, which was in northern Uganda, which affected over 420 people, where we lost Dr. Rukia, was a major epidemic in Uganda. And we lost almost 230 patients within that first epidemic of Ebola. That was a major outbreak. We then also recently had COVID. COVID was also a major pandemic, not only in Uganda, because now the whole world was also involved. So the world was able to see what we go through as well.
Over the years, Uganda has developed a robust integrated disease surveillance and response system that takes active disease surveillance in communities by village health teams, and this facilitates early detection, safe transportation of samples, laboratory testing, contact tracing, case management, and community engagement are all positive strengths for Uganda's better management of epidemics.
The leadership, which is very transparent, when there is an outbreak and it requires notification of the world, international community, we tell the international community. We've been able to manage all previous outbreaks based on evidence and science. We've been able to mobilize the whole masses of Ugandans to give them the accurate information, and the people take the information. And our biggest strength also is that the community trusts our scientists. The people of Uganda trust our health workers, so what we tell them they believe and they follow. Because public health practice requires that people believe what you say, because it's them convincing to come and seek care and also believe that the care they're receiving is the appropriate and evidence. First of all, we've also have many trained health professionals, and they have been helping fight all these epidemics in the other countries. So we have a pool of expertise and resources in this country.
These outbreaks have not only tested and strengthened the country's preparedness and response system, but also given health workers experience. Uganda's Ministry of Health also puts more emphasis on infection prevention and control, especially by the health workers, and logistics and supplies management to ensure that personnel protection equipment is available when needed.
But it is important that we protect the health workers. It is also important for health workers to understand that in their normal day-to-day routine work, they need to protect themselves, because we don't know what a patient will come with. So it is pertinent that they put on their gloves, keep their masks on, use aprons.
However, scientists now want the country to develop capacity to solve health challenges using the advancement of science like gene therapy and biotechnology to develop vaccines like for Ebola and COVID-19.
Applications of that, obviously developing the vaccines, as we have seen in COVID-19. A lot of transgenic technologies were used to create some of the vaccines that were used to, to recover and manage the pandemic. Also, the last Ebola epidemic, mostly in West Africa, was solved by genetically modified drugs and even vaccines. In fact, some of those vaccines were used here in Uganda to protect health workers at the borderline, especially those that would meet potential patients coming from DR Congo, had to receive genetically modified vaccines to protect them. So again, those are some of the ways pandemics can be solved using this gene technology. Another way is to control the vectors. If the pandemic disease is transmitted by, say, a vector insect or a mosquito or a tick, those also can be controlled using transgenics.
So Uganda, as we celebrate 60 years of independence, we've come a long way to build our own system, to learn how to have leadership to respond and manage. And we've also now learned that we need to be able to manufacture some of the items we need to respond to diseases, because that becomes national security if we can't do it. So we are in a position to plan better for our country, to know that for national security, health is paramount.
As the country counts years of independence, it is critical that independence is achieved in areas like health, where the country needs to develop the pharmaceutical industry to manufacture medicines and vaccines to minimize relying on foreign health solutions. Joshua Kagoro, Adia Nakuti, UBC News.